Good morning. It is September the 11th, and I am here to talk a little bit about insurance, health insurance. So, having said that, our open enrollment is October 1st. Anyone who works 30 or more hours on average over a 90-day period is eligible for health insurance. So let me talk a little bit about it. This year we are with Blue Cross Blue Shield, just like last year. This year we have 3 plans. We usually have 2, but this year we have 3 because we were able to find a less expensive option for people. So, having said that, let me talk about the plans. Plan 1 is called Blue Value. It is the same as our base plan last year, and all plans cover 100% of routine care. It is less expensive though, but the provider network is smaller. Blue Value, our first plan, is good for UNC providers. So, if you have a UNC doctor, if you're new to the plan and just getting signed up and don't have a physician, this is a good one for you. The UNC providers, there's a vast network of them. They're all in plan, and this is much less expensive. For you folks in Fayetteville, it covers most all of the providers in Fayetteville. And we do have a list, so don't worry, okay? I just want you to listen a little bit to this. So, Blue Value, UNC providers, less expensive. The cost on it is $59.28 a pay period. And that's compared to $96. So much less expensive, great value, just limited providers. The second plan is called Blue Option. And Blue Option is the same as it was last year. It covers Wake, Duke, UNC. So it has a bigger group of providers. Same coverage as Blue Value. Last year it cost $96.45. This year it costs $99.67. So great thing is the increase in price is only $3. You might want to choose this option if you have an ongoing medical condition and you're seeing a WakeMed or a Duke doctor and do not want to switch. Okay, so same plan as last year, $3 more expensive. The last plan we have is something called a buy-up plan, and about half of you chose the buy-up plan last year. The buy-up plan gives you a co-pay for doctor's visits. It also helps more with medication. So there's a $10 co-pay on most generic medications, and for the ones that aren't generic, they pay up to $100 before you have to chip in. So all of you that were on the buy-up plan last year, it has not changed. The pharmacy prescription policy is still the same. The cost, though, on the buy-up plan is a little bit more. Last year, it was $109.67 a pay period. This year, it's $130.97. So an increase of around $20 for the same coverage. Remember, we contribute a vast majority of money to these plans for each one of you. This is one of your benefits for working 30 or more hours. Okay, having said that, it's a lot of information to take in. There are a couple of extra things with your insurance. You get something called Blue Connect, which is an app you can go to look at claims. You also have something called MD Live, where you can go visit the doctor through the telephone, through your computer, not have to have an office visit, and can get medications and diagnosis for small routine things like bronchitis, bladder infections, and those types of things. So that's a really nice thing. Remember, dental insurance is unchanged. I have dental forms, and dental insurance is still $20.73, I believe, a pay period. We are not doing AFLAC this year. You can continue your AFLAC policy by talking to the representative, or you can start an AFLAC policy by talking to the representative. Eye care enrollment is in January, so we'll talk about that then. And short-term disability right now requires doctor examination paperwork before approval. So going forward, we will be in salons talking about this. Every one of you who is eligible, we have a packet for. The packet includes several things, including a cover letter with a short explanation, a cheat sheet, which is what I just went over, how to understand this. It has a list of providers for you. It has information on what plan you were on last year, so that you know what was going on last year and what you want maybe to change or keep the same this year. We have our information booklet that you can refer to. And we have a sheet that we've got to have signed by everybody. And that sheet is the same one that you're used to. Remember this? Okay. Even if you decline to take the insurance, I have to have the sheet signed. And if you choose to take it, then this will also tell us which plan you want to be on. Okay? So, it's a lot of information. I just wanted to briefly go over it with you because I will be coming around. Your area managers will also be able to answer questions for you. And hopefully this will all make sense. And we'll get all these things signed and get everybody signed up who'd like to have health insurance. Okay, have a great day. I'll see you later. Thanks.